Welcome to the Emergency Management and Preparedness Inclusion of Persons with Disabilities webinar series. I'm Lewis Krause from the Pacific ADA Center, your moderator for this series. This series of webinars is brought to you by the Pacific ADA Center on behalf of the ADA National Network. The ADA National Network is made up of 10 regional centers that are federally funded to provide training, technical assistance, and other information as needed on the Americans with Disabilities Act. You can reach your regional ADA center by dialing 1-800-949-4232. Real-time captioning is provided for this webinar. The caption screen can be accessed by choosing the CC icon in the meeting control toolbar. To get that meeting control toolbar permanently on, press your Alt key once, and you can press it again if it doesn't stay on. As always in our sessions, only the speakers will have audio. If you do not have sound capabilities on your computer or prefer to listen by phone, you can dial 1-669-900-9128 or 1-646-558-8656 and use the webinar ID 872-0730-7836. The webinar is being recorded and will be able to be accessed on the adapresentations.org website in the archive section next week. This is the 7th year of this webinar series, which shares issues and promising practices in emergency management, inclusive of people with disabilities and others with access and functional needs. The series topics cover emergency preparedness and disaster response, recovery and mitigation, as well as accessibility and reasonable accommodation issues under the Rehabilitation Act of 1973, the Americans with Disabilities Act of 1990, the ADA, and other relevant laws. The upcoming sessions are available at adapresentations.org under the Schedule tab in the Emergency Management section. These monthly webinars occur on the second Thursday of the month at 2:30 Eastern, 1:30 Central, 12:30 Mountain, and 11:30 a.m. Pacific Time. By being here, you are on the list to receive notices for future webinars in this series. Those notices go out 2 weeks before the next webinar and open the webinar to registration. You can follow along on the webinar platform with the slides. If you are not using the webinar platform, you can download a copy of today's PowerPoint presentation at adapresentations.org and go to the Schedule section of Emergency Management. At the conclusion of today's presentation, there will be an opportunity for everyone to ask questions. You may submit your questions using the chat area within the webinar platform, and the speakers and I will address them at the end of the session, so feel free to submit them as they come to your mind during the presentation. To submit your questions, you can type and submit them in the chat area text box or press Alt-H and enter the text if you are using keyboard strokes. If you are listening by phone and not logged into the webinar, you may ask your question by emailing them to adatech@adapacific.org. That's ADATECH@adapacific.org. If you experience any technical difficulties during the webinar, you can send a private chat message to the host by typing in the chat window. You can also type your comment in the text box and enter, or use keyboard, again, using Alt-H to access the chat box. You can also email any technical difficulties to us at adatech@adapacific.org or you can call us at 510-285-5600. Today's ADA National Network Learning Session is titled Preparedness for All, Whole Community Emergency Planning. Disasters and emergencies like the current COVID-19 pandemic disproportionately affect Americans with disabilities and chronic health and mental health conditions. To close this gap, the Association of University Centers on Disabilities, the AUCD, developed Prepared4ALL, a public health campaign to link disability organizations and people with disabilities to local emergency management and public health preparedness agencies. Developed with strong stakeholder input, Prepared4ALL aims to harness disability community strengths with the goal of increasing the number of people with disabilities and disability organizations that are actively engaged in local emergency and public health preparedness planning efforts. Today's speakers are Adrienne Griffin. Adrienne is the Senior Director of Public Health and Leadership at the Association of University Centers on Disabilities, AUCD. She is the Director of the National Technical Assistance and Training Center on Disability Inclusion in Emergency Preparedness. Sue Wolfe-Fordham is a Senior Program Manager at the Association of University Centers on Disabilities and Deputy Director of the National Technical Assistance and Training Center on Disability Inclusion in Emergency Preparedness. And Sue and Adrienne are going to take it from here.
Thank you, Louis. So my name is Adrienne Griffin, and today I will be tag teaming with my colleague, Sue Wolfe-Fordham. We're going to be talking with you about Prepared4ALL, which is a project of our National Center on Disability and Public Health. And the focus of Prepared4ALL is really to support disability organizations to get a seat at the local emergency planning table. So for today, we will give you some background, context on our project, some of our initial research, and we'll talk through our approach. And we'll also share how we have really engaged stakeholders and involved them throughout the process. Then we'll describe our Prepared4ALL online course and give you some background on how local disability organizations and local emergency and public health preparedness planners can get involved, share some tools, and we'll share with you how to access all of this too. And we hope you stick around until the very end, because we have some bonus resources for you at the end, in addition to the copy of this presentation. So with that said, we'll go ahead and get going. So next slide, please. Just a bit of background on the Association of University Centers on Disabilities, or AUCD. AUCD advances policies and practices that improve the health, education, social and economic well-being of all people with disabilities, their families, and their communities. So we focus on overcoming barriers to inclusion and wellness through research, training, service, and advocacy. And we want to make sure that you know that AUCD network centers are actually in every state and territory, and we encourage you to work with us because we do have a presence in every state and territory. So please feel free to connect with your closest center via the map on the aucd.org website. So next slide, please. Prepared4ALL is really all about local disability organizations. And when I mean local, I mean at the city, town, county level, local. So it's all about local disability organizations engaging with local emergency management and public health agencies with the overall goal of strengthening existing relationships or perhaps building new relationships and sustaining those relationships. Our ultimate goal is for people with disabilities and disability organizations to have a seat at the local emergency planning table, and through increased input, really strengthen inclusive local emergency planning. We fulfill our mission by training disability organizations as our primary audience and really supporting those organizations to engage with local emergency planners and build connections between them. While our primary audience includes disability organizations and people with disabilities, our secondary audience includes emergency managers, public health preparedness planners, and healthcare professionals, mainly at community health local centers. So the components of these projects are really very flexible, so you can customize it at a local level, and we encourage partners to do that. So at this point, I'm going to switch the virtual podium over to you, Sue, to talk a little bit more about why we focus on the local level. If you advance the slides, please. Thanks.
Great. Thank you, Adrian. This is Sue Wolf-Fordham. Thank you also to the Pacific ADA Network and the National ADA Network. I'm going to talk now about the context for Prepared for All and answer the question, why is Prepared for All important? On your screen, you see in big letters, all response is local. We focus on the local level, meaning city, town, or county, because this is the level closest to the community, and this is the level where emergency planning and response begins. Next slide. The next part of the context relates to equity. Let's talk about the media headline on the screen. Black disabled man dies from COVID-19 after Texas hospital refused to treat him. To the right of the text is a photo of Mr. Michael Hickson, a Black man who we can tell from the photo is sitting in a wheelchair. He died because his doctors wouldn't give him the medical care he needed to survive COVID. They made some really inaccurate assumptions about his life, his family, and his 5 children and his wife, and the value and quality of his life. We know that people with disabilities have greater morbidity and mortality due to emergencies, disasters, and pandemics than people without disabilities. Much of this sad fact can be explained by systems issues. And so this project is about closing some of those gaps as well as about systems change. Next slide, please. The next slide has 2 images of silos. One is titled Emergency Management, one is titled Public Health. And within each silo are circles showing the different levels of either emergency management or public health preparedness, the federal, the regional state level, the regional local level, and the local level. So we know that the American emergency management system is really a system of systems. Every state, region, and local community operates differently, and all have their own emergency plans and roles. There's often overlap of oversight and function. So our system is siloed by design. But as we also know, silos can lead to systems gaps, and systems gaps can lead to equity and access gaps. So that's another reason for Prepared for All. Next slide, please. Now I'm going to talk about the program components and how we develop the program. There are 3 main components: the online course, the what we call town hall meetings. They happen monthly and they're about peer-to-peer interaction. And then we have a student and trainee component where students and trainees from our network of universities are being trained to coach and support local disability organizations involved in our project. And of course, training the next generation builds sustainability. We're going to be going through these components in more detail. Next slide, please. I'd like to talk for a little while about our program development. So we surveyed 61 emergency and public health preparedness planners. We had key informant interviews with experts. We reviewed 300 plus resources, including trainings, informational documents, tools, templates, webinars, and reports. And we did a lit review. Our key finding was the big gap was information about the how and the why. And this means, aside from legal requirements, Why is inclusive emergency planning important? And if it's so important, how do we do it? I see a question in the chat about the online course, and we're going to be going into that in a minute. Next slide, please. I'm going to speak now about our survey. The survey results support what I've just shown. So planners told us community members with disabilities were ranked as the most powerful resources for local emergency planning, but only 25% of our respondents reported engaging them as a resource. So what this means is people with disabilities are seen as a valuable resource, but aren't included enough. According to the planners, they're concerned that the disability community doesn't have enough information about our emergency management system and the roles of managers and planners. And also, according to the planners, they don't have enough information about the ADA and meeting access and functional needs, or including people with disabilities in whole community planning. We understand local government personnel are often short on time, money, and staff, but they're open to partnerships with the disability community. They may just not know how to go about doing it. Next slide, please. On the screen are some quotes from our survey from the planners. It's a two-way street. We need to keep in mind about people with disabilities, and they need to make sure local emergency management knows what their needs are. Include emergency managers in the regular planning for organizations that support people with disabilities. Involve local emergency managers. Don't go around them. And finally, there's typically very little in the way of dialogue between emergency managers and these types of organizations. It would be hugely beneficial for these groups to seek out emergency managers and begin discussions about inclusiveness. I'm now going to turn it over to Adrian, who's going to talk about the collaboration and engagement approach we just developed. Next slide, please.
Thanks, Sue. So we've based our work on an approach we call Prepared for All. This approach is really a set of strategies for problem solving that are evidence-based and really look at how to collaborate and engage using existing organizational and community strengths, and while doing that, really appreciating the challenges. So these strategies are based on some tried and true public health approaches, action learning, which is where you have a team that learns while solving a problem. Action research, which is when you apply a research strategy to a particular problem. And appreciative inquiry, which is a strengths-based approach to leadership development and organizational change. So we've combined these three approaches and really have applied them here in the Prepared for All wheel that you can see on the screen. This slide here is composed of 9 parts and spells out Prepared for All. So each letter in the mnemonic stands for a different strategy to engage and collaborate with other community-based organizations and local emergency and public health preparedness planners with the goal of increasing inclusion in local emergency planning. So next, I'm just going to walk you through each of the letters in this wheel. So the first P is for pinpoint. Pinpoint or identify local emergency management and public health agencies and really learn everything you can about them. You need to pinpoint the disability inclusion issue or challenge at hand. R is for related. Find organizations with related goals for collaboration. The E stands for engage. Along with your partner organizations, engage the local emergency management public health agencies and show them your interest in their work and what your organization can offer them. The next P is for positive. It's really important to be positive and focus on the strengths of your organizations, your partners, and the local community in solving problems together. Focus on what you can do and what you can accomplish, not what you can't, and identify ways to fill in gaps together. A is for advance. take advantage of opportunities and timing as you move forward. And then the R stands for reflect. So you can be thinking and reflecting as you go. And the R in reflect also really helps to think through how you don't just get stuck by saying we have no time, or we have no money, or we don't have enough staff, or those kinds of responses that you might hear. E is for envision. Envision a solution and then design it, test it out. D stands for deploy, where you deploy and test out your solution. And then you'll see some questions over here in the right box. It's important to ask, is your solution for all? Are you allowing everyone the same access to the information at the same time, which is what we call state, same time access to everyone? And do all local partners own and share the issue together? Is it really for all? So if you go to the next slide, what I want to do next is just walk through an example of applying the Prepared for All mnemonic in action. So we've taken an example of an emergency dispensing site. Now, this could be for a COVID vaccine clinic or a traditional seasonal flu clinic. And let's say hypothetically, the city website posts the clinic plan and a disability organization sees that there are potential access and inclusion issues. So just walking through this Prepared for All wheel, the group might start with the first P, pinpointing the inclusion issue. The plan might not be inclusive. So the group pinpoints who the local emergency management group is, who are the public health agencies. And you can check with the local government website and find the contact information for the local public health department that's running the clinic. And the group, when they do this, they're actually surprised to find out that there is a health office, which is part of the land management department. So next, this group goes to R, relate, and thinks about local organizations that might have some potentially related interests around the clinic. And the group reaches out to food pantries, which serve people with disabilities, houses of worship, or other local community health centers, and other allies like the Center for Independent Living. Then the group needs to begin thinking about how to approach the local health office. So going to the next letter E for engage, at this meeting, in this hypothetical example, the group discusses the local public health system and the Americans with Disability Act and the issues around the current clinic plan. And the group makes a question list about the clinic plan and a strategy to engage with the health office. So P for being positive, the group now thinks of themselves as a local action team using this Prepared for All model and completes the Prepared for All online training. The team reviews the clinic plan again and finds more gaps. So now they start a list of clinic resources just with gaps, potential solutions that focus on positives the community can bring together, other resources and other organizational strengths. A for advancing opportunities. So now a team member shares that her sister is actually friendly with a local public health nurse, and she'll ask her sister to make a connection, thinking that her nurse friend might be able to link the team to a local public health planner. R for reflect. So now the team reflects on their work to date by answering the Prepared for All reflection questions. And in doing so, they realize that so far things are moving forward and they have some potential connections in the public health department. And as a group, they're pretty, they've found that they have some tentative solutions, and what they had assumed about the size of the public health department being large was actually wrong. In fact, the public health office in this particular hypothetical example is small and situated in an unrelated department. So now they think about other potential issues, like in such a small office, would they be able to make plan changes quickly? Or would plan changes then need to be approved by yet another department that might not know about disability issues? So a lot there in the R for reflect. Next, under E for envision, the team and the public health planner that has a lot going on meet to talk about the clinic plan and the gaps. And they think together and envision what a successful inclusive clinic would look like. And then they discuss specifics. There's no design to set up the clinic space in a physically accessible way. And the team shares an article from the Prepared for All website that gives an example of an accessible setup. So using this article as a guide, the planner agrees to reconfigure the space, and then they discuss whether the clinic messaging and the communication is accessible. The Prepared for All action team shares information about plain language and alternative communication formats, and offers to review current messaging and make suggestions about communication access and inclusive language. The planner welcomes this offer of help and implements many of the suggestions. So now we're at the final letter in the acronym, D for deploy. So this clinic happens as planned, and some of the suggested modifications have been done. There is an informal data collection about user experience and messaging, physical access and accommodations. And while everything wasn't perfect and there were some glitches, overall, it was a success. The planner keeps notes of what went well and what could be improved. And now the planner wants to work with the Prepared for All action team for the next clinic and for all upcoming COVID-19 clinics. So just reviewing this example with the For All, this team meets with the public health planner again before the clinic to just confirm whether the clinic really will be for all. And together they ask the state same time access to everyone questions. Is the space accessible? Is the clinic process inclusive? How about the accommodations? Are communications accessible? Does the site really use an overall inclusive philosophy? What about cultural competence? Is there general awareness of community needs? So after the clinic, they work together to create an after action report to record lessons learned. So you can see while this framework originally developed for engaging local disability organizations, it could actually also be used by local public health planners as they make outreach to disability and other community organizations. So thanks for allowing me a moment to walk through that with you. Just wanted to give you a taste of our approach. So if you go to the next slide, just wanted to give you an overall overview of the program model. This slide highlights our key players and how they work together. So we've convened an advisory committee of national disability organizations and groups that have local chapters or affiliates, as well as a panel of subject matter experts in disability, health, and emergency planning fields. And together, they guide our work in what we call a community of partners. Our advisory committee reaches out to their local chapters or affiliates to encourage participation in the project. And both the subject matter experts and the advisory committee have really just been wonderful and informed the online training and the tools that we have developed for our Prepared for All outreach. We also have trainees from our network of universities who receive training to be disability inclusion coaches, as well as other allied health fields. And then these coaches act as liaisons between the national organizations and local disability organizations and local action teams. And so, and the other thing just to review here, and you can see in the green box, so we have our monthly town hall style meetings for our disability organization affiliates to really just connect with each other in a peer-to-peer way as they're developing new Prepared for All action teams or joining local inclusive planning efforts that might already exist. So this is really an overall part of the capacity building process for us. And all of these factors lead to our ultimate goal of forming and increasing partnerships between local emergency planning entities and disability organizations. So next slide, please. So we've overall taken a community of partners approach with our advisory committee organizations and our subject matter experts who've really collaborated with us to really just help steer the efforts, and just been wonderful whole cadre of partners in this effort. So we just wanted to say thank you to them here. Next slide, please. And you can also see that we have a very diverse, next slide, please. You can also see that we have a very diverse group of subject matter experts that really span the different geographic regions and different levels of expertise across the country. So if you go to the next slide, I will pass it back. And next slide again, please. Thank you. I will pass it back to Sue to give you an overview of our whole community inclusive emergency planning.
Thanks, Adrian. Next slide, please. Again, there's a lot of text on this slide. I'm going to describe it rather than read everything word for word. Our online course is role-play simulation based. It's interactive and it's applied learning, meaning we're asking the learner to apply the new information we've given them to some real life types of situations. Our community of partners and our research inform the development of the course. It's available online for free at our website. Each lesson takes between 45 minutes and an hour to complete. If you finish all the lessons in order, you get a certificate, or you can take only the lessons that interest you. During the course, the learner learns about such things as our Prepared for All process and strategies that Adrian mentioned, how to apply the process and strategies to COVID testing and vaccine distribution, the negative impacts of disasters and COVID-19 on people with disabilities, the American Emergency Management System. Then there are some topics that planners may need more info about, like disability demographics, community living, accessible and respectful communication, and accessible meetings. We have a unit on the ADA, but the ADA is also mentioned in other units. ADA topics include requirements relating to physical and program access and effective communication, COVID-19 and ADA issues, service animals, and ways to discuss the ADA that might resonate with emergency and public health preparedness planners. There's a lesson on whole community or inclusive emergency planning, including access and functional needs in the CMIST framework. And then there's a lesson on how to hold a community stakeholder meeting to identify and close disability-related gaps in the local emergency plan. At the end of the course, the learner receives a resource list and a workbook guide for assessing local emergency plans. For each lesson, there's a learning agenda outlining the lesson and space for note-taking. Next slide. Thank you. This is a go at your own pace training available anywhere, anytime, 24/7 via browser on computer, tablet, or phone. You can see in the slide that I've made some what I'm going to call a la carte suggestions. So if you're interested in inclusive emergency planning, check out lessons 7 and 8. If you want more info on disability, demographics, communication, and accessible meetings, go to lesson 5. Background on the emergency management system and ADA, lessons 4 and 6. COVID impacts and legal rights, lessons 3 and 6. And the Prepared for All approach, lessons 1 and 2. Next slide, please. So with this slide, I'm not going to read it. I'm going to use it as a little gateway to take you into our course, and I will do that in just 1 minute. In fact, let me try sharing my slide. Now, hopefully you can see my screen.
We can.
Okay, thank you, because I've lost a little of the view of you. So welcome to Disasterville, USA, a fictitious county. In the course, the learner takes on the role of Terry Trainee from Tornado Gap County, USA. Terry is a professional from Tornado Gap's local disability organization, Access and Equity, Inc. And yes, we do have little cheesy jokes in there. Tornado Gap's county government and local disability and other community organizations want to collaborate to identify and close emergency planning gaps related to people with disabilities, chronic and mental health conditions. Terry has heard about Disasterville's inclusive emergency planning success and is visiting Disasterville to learn more about their work. Now I'd like to describe what you see on the screen. So this is a meeting room, and I'm going to describe the people here and their role. Starting from the left is Carrie, the Disasterville ADA coordinator. She is a woman with dark skin. She's wearing a mask, a brown jacket, and jeans, and her service animal with her is a miniature horse. Next to her is Rachel, a woman with light skin and salt and pepper hair. She's wearing a mask. She has a white t-shirt on, and you may not be able to see it, but she has a glucose monitor. She has diabetes. Next, we have Marco and Franny and their baby Juniper. Marco and Franny are deaf. They're wearing masks. They both have light skin. Marco has a man bun and is wearing glasses, a reddish sweater, and a gray t-shirt. Franny has brown hair, a green top, and blue capris. Next to Franny is PJ, the Disasterville Preparedness Planner. PJ has light skin, wearing glasses, a mask, a white t-shirt, and beige pants. Next to PJ is Alan. Alan has dark skin, gray hair, a white mask, wearing a purple top and gray pants. And next to Alan is EJ, the local planner. He's an older man wearing a mask with a white shirt and gray pants. And together they're talking about the ADA. In the interest of time, I'm going to scroll down and show you an example of an interaction. You can see the thought bubble for the learner to think, and it says, under the ADA, equal access and effective communication related to COVID-19 would include. And then the learner has a number of choices, and when the learner pulls down a choice, there's feedback. The choices are an accessible site to receive the COVID-19 test or vaccine, a sign language interpreter for a person who communicates via sign language to explain consent forms and potential vaccine side effects, providing accessible telephone services such as TTY if someone who uses sign language wants to make a phone call while waiting for the shot, permitting a service animal to accompany its owners while she receives a vaccine, and plain language document to explain the vaccine to a person with limited English literacy. I'm going to now hit the pull down menu, and you can see the feedback on the last one, which is plain language. The feedback is, that's right, providing plain language documents is required. Now I'm going to stop sharing my screen and go back to the PowerPoint. Thank you. Next slide, please. What you see on the screen now is a screenshot from our active planning workbook. Along with the slides you're going to get after today, you're going to also get a PDF of this guide. The guide's discussed in lesson 8 And it's about how to hold an inclusive collaborative planning meeting to review an emergency plan that already exists or to help develop a new one. There are 3 parts that you see in the 3 boxes on the screen. The 3 parts to the meeting are: where are we now? A needs assessment and gap analysis. Where do we want to be? Setting priorities. How do we get there? Closing the gaps. The program participants follow the 3 steps, and by the end, they have developed an action plan to use strengths to close the gaps. This process and the workbook guide were successfully piloted a number of years ago in Massachusetts. 100% of the participating communities identified at least 5 gaps related to inclusion in the local plan, and all of them identified a strategy to close the gaps. Participant satisfaction with the meetings was very high. Now, Adrian's going to talk about local disability organizations and their role. Next slide.
Thanks. Thank you. Thanks, Sue. And you could actually go to the next slide after this one. So let's go back to the local community and local disability organizations. So here's what the participating local disability organizations would do. They increase emergency preparedness knowledge and self-efficacy. They form action teams with other community-based organizations or join ongoing community emergency planning advisory groups if those already exist. They learn new collaboration and problem-solving strategies, identify and connect with local emergency planning efforts, and really build partnerships with local emergency and public health preparedness planners. There's also just a really neat opportunity to expand networks. And also importantly, the local action teams strengthen the community outreach and really expand recognition of the need to always include people with disabilities in planning. Next slide, please. So here on the next slide, we have a word cloud that is a summary from our town hall meetings. So for disability organizations, it's really important to connect their Prepared for All work with the organizational mission and vision. So the word cloud on this slide shows the results of an informal poll that we did of our disability organization partners. And this word cloud was generated when we asked what comes to mind when they think about their work. So here are some phrases and words the organizations came up with: improve quality of life, empower, innovation, support, respect and dignity, independence, health and wellness, live, work, learn, and play, enrich and enhance. So you'll notice involvement in community emergency planning relates to all of these terms. Next slide, please. So next, we wanted to just share with you the packet of outreach information that a disability organization would get once they are part of the Prepared for All initiative. The first one I wanted to go over is our outreach guide. So there's a 1-page summary plus a very short, what we call elevator speech to use in approaching local planners. There's a tip sheet with talking points about the importance of engagement and collaboration, as well as resource and referral links and communication toolkit. So the idea was to make outreach and engagement as clear and as easy as possible for both disability organizations and local planners. In communities in which local planners are making the first approach to disability organizations, these tools could also be helpful. So for example, these documents could show planners where disability organizations might be coming from, where to find them. So since disability organizations are likely to want to think about engagement with planners and inclusive planning in terms of their organization's mission and vision, planners can consider outreach and really think about asking organizations about missions and emphasizing how involvement in local planning would further the mission of their service or community engagement and community inclusion. Next slide, please. So here's an example from our Prepared for All communication toolkit. The toolkit consists of sample social media posts and key messages about the project. While these are mainly intended for disability organizations to use, local public health planners might find the fact-based messages like the did you know people with disabilities are 2 to 4 times more likely to die or sustain injury during a disaster than people without disabilities, might find those facts useful for sharing with the community at large. Local planners might consider providing the communication toolkit as part of their outreach to the disability community as well. Next slide, please. So this might look familiar. I know Sue had talked just a moment ago about the silos between our American emergency management system. So another component of the outreach toolkit is how to find your local emergency planning agency. And while it might be obvious to emergency and public health preparedness planners how local government works and where their offices fit in, it's not so obvious to others in the community oftentimes. So Prepared for All provides a how-to for disability organizations to identify their local planners and an example of how the emergency system in America really works. So planners can use this resource as a tool for explaining the American emergency management system in a particular local system as they collaborate with disability community partners who might be new to the emergency system locally. Next slide, please. Another tool that we developed is really a set of resources and referral links to some non-English translation resources and American Sign Language interpretation resources. So we encourage local disability organizations to share this and really develop local versions of this and add other resources as they go to collaborate with their local partners and keep this collaboration going. All right, next, I'd like to shift gears and talk just a little bit about our disability inclusion coach effort. This really is a way for us to keep going for future generations to pay attention to disability inclusion in emergency planning. And the good news is that this is available not only for AUCD trainees, but for any public health trainee or any emergency management person who's training. Next slide, please. So just a little bit of the Disability Inclusion Coach project for you here. The trainees can complete the Prepared for All online training to become disability inclusion coaches and really then engage with emergency preparedness and local emergency planning. We facilitate training on coaching skills, and after the students or trainees complete the online training, then we link them with local participating disability organizations or local action teams. And then these trainees or the new disability inclusion coaches act as liaisons between local Prepared for All action teams and our technical assistance center, and really engage in related action research projects. So we envision these coaches helping to further sustain the project as they move forward in their professional training. They can continue to share the Prepared for All approach with new audiences. So next I will pass it over to Sue to talk about how Prepared for All really is a different kind of program. Next slide, please.
Thanks, Adrian. So what's our secret sauce? First of all, our audience. Disability organizations are our primary audience, and this includes advocacy organizations, disability-led organizations, and provider organizations, as well as community health centers. Our secondary audience is emergency and public health preparedness planners. And I should note here that our funder is the one that chose our target audiences. Our approach is about the how and the why, strategies to build engagement, collaboration capacity. Our project's informed by experts with and without disabilities and well-known successful public health strategies. And we provide a wealth of engagement and collaboration tools. There's peer-to-peer support and problem solving at our town hall meetings, and students and trainees are available to support local emergency planning work today and build future sustainability. But to me, the thing that really stands out is this is about flexibility. There's really a menu of options, and the project can be tailored to individual organizations and community needs. So you can take the course in different ways. You can not take the course, but go to the town halls, et cetera, et cetera. And we built this in because our research showed that's what people wanted and people needed about emergency planning. Next slide, please. This also demonstrates flexibility. Our outcome is partnerships, or what we call a seat at the table. Now that will look different for each community. So for example, in some communities, it might mean a literal seat at the local emergency planning table. It might mean submitting comments on the local emergency plan, working with partners to identify gaps in the local plan and strategizing about how to close the gaps, sharing information about how to find qualified sign language interpreters, for example, at emergency shelters or vaccine dispensing sites, or the disability community sharing other resources that it knows about that planners may not know. It may also mean reviewing alerts, warnings, public education, and other communications intended for the disability community. Now I'm going to turn it back to Adrian to close us out. Next
Thank
slide.
you, Sue. Thanks. So as we wrap, I wanted to acknowledge our team, first and foremost, Sue, and all of the work that she has done as the deputy for this project over the last year. Lex Owen, she has really spearheaded the disability inclusion coaching side of things and our overarching evaluation. And Danielle Augustine, who has a background as a health coach and has really spearheaded some of the motivational interviewing and appreciative inquiry work that we're doing with our partners in the town hall settings. So thank you to a fabulous team. Next slide. We also want to share thanks to our CDC partners. We have funded this work through our AUCD CDC cooperative agreement, and the Prepared for All initiative has been very fortunate to collaborate with two sister grantees, the National Association of County and City Health Officials, or NACCHO, and then ASTO, the Association of State Territorial Health Officials. So ASTO has identified and trained and embedded disability and emergency planning specialists in 12 state health departments, and NACCHO has done the same with 10 local health departments. So as part of all of our projects, we meet regularly, and we have held joint webinars together. And we also just wanted to extend our thanks to these organizations as well. So next slide. So you might be wondering, how can I get involved in Prepared for All? Well, there are three main ways we would really encourage you to be involved. First, please take the free training. That URL is on the slide. That's https://bit.ly/prepared4all online. So there you will see the learning agendas and the modules that Sue gave you a preview of, as well as resources and that collaborative, inclusive emergency planning workbook guide. So I encourage you to check that out. Second way to get involved is to attend one of our monthly partner town hall meetings. They happen the third Wednesday of every month, 1 p.m. Eastern, for an hour. And it's just a fabulous way to engage in some peer-to-peer sharing. And they're also an opportunity for support and problem solving. And we really encourage emergency and public health planners and others to join us. They're all welcome. A third way to get involved with Prepared for All is involve your students or trainees. We know that many of you wear multiple hats and might be regularly engaging with students through courses that you might teach or you might be engaged with. So check that out as well. And that link is here as well. And we will put the links into the chat. Thank you. All right, so next slide. Overall, just want to say thank you and give just a little bit more of the bonus resources if you've hung out with us and stuck with us through this entire presentation. So we thank you. We will be sharing a link to a video with more information about our online training. So that link is going to appear in the archive with this webinar. And in that video, there is a highlight from a student who is currently involved in our disability inclusion coaching program. She describes her experience in Idaho. And we also have a professional from the DC regional area talking about her experience in the Prepared for All town hall and how the town hall really was impactful on her work and her organization. And so at the end of today's slides, actually, we have a couple more bonuses for you. If you keep going forward, please. Thank you. We have our contact information here. Please stay in touch. The email is preparedforall@aucd.org. We also encourage you to join our listserv and really just keep learning together. Please feel free to stay in touch with either myself or Sue. Our emails are here. My email is agriffen@aucd.org. And you can reach Sue at swolfordham@aucd.org. Okay. So that's what I wanted to say for this slide. If you forward to one more slide, we have some bonus resources links, I believe, on the next slide. Yes, here they are. So as we mentioned, we will be making these links available to you through today's webinar slide deck. And also want to point out, we have a number of resources in our archived webinars, which are available through our National Center on Disability and Public Health. So we encourage you to check those out as well. And finally, next slide, one other resource that we wanted to make sure that everyone was aware of is our Public Health is for Everyone toolkit. This online toolkit has resources related to disability inclusion for all aspects of public health and includes documents from the needs assessment and the environmental scan we conducted for this project, as well as other very relevant emergency planning and disability inclusion resources. So we invite you to check it out and share any resources that you have found helpful by using the Share Your Resources tab. And the Prepared for All, the Public Health is for Everyone URL is www.PHETOOLKIT.org. And so with that, I want to thank you for your time and your attention. And I believe at this point, we have concluded our formal remarks, but we would love to engage with some question and answer time. Thank you.
All right, thank you, Sue and Adrian. All right, everyone, this is your chance to submit your questions in the chat window if you have not already done so, and we will start rolling through them right now. First question that was in there and was answered in the question, but and actually was just covered by Adrian recently, but let's get it in here anyway, and that was can you repeat the 3 approaches that you mentioned before, the prepare, mnemonic? And the answer was the online course, the town hall meetings, and the student and trainee involvement.
This is Adrienne. I believe that question was actually asking about the evidence base for the Prepared for All mnemonic.
Okay.
And the evidence base for that is a combination of appreciative inquiry, action learning, and action research. Those are the 3 public health evidence bases that we've combined in a unique way for the Prepared for All approach. Thank you.
Great, thanks for clarifying that. All right, the next question. Why aren't people with disabilities included in the planning process so that accessibility issues can be worked into the plan instead of having agencies working with people with disabilities provide feedback after the plan is developed?
So this is Adrienne, and I think that the person who posed this question later on said they understood, they got their question answered, but I would love to respond to it. It's our goal for people with disabilities to be at that table all the time from the very beginning. So let me just reiterate that it's about disability inclusion overall. Sue, I don't know if you have anything else to add to that.
I do, just from my own research. It's really rare that I find a community that doesn't have any plan, although I have on occasionally found that. So what I find in my work is the community already has the plan, however it was written, and sometimes it was written a long time ago, and what they need is for people with disabilities and disability organizations to review whatever exists in whatever kind of form it exists. And sometimes they're very full and complete plans, and sometimes, as just happened to me recently, they're an outline of plan. So of course, we think people with disabilities should be included from the beginning, but that's not always the situation we're presented with. I've also worked with community health centers, and I found the same thing. It's rare that I find no plan. It's almost always I find a plan. It could be full, it could be slim. So that might answer that part of the question.
Great. All right. The next question, is there a municipality you can cite as an example of where your program was implemented and is working?
This is Adrienne. Yes, sure. So we have had some nice success with the Department of Health in Florida. They have had really good uptake and utilization of the Prepared for All approach and been invited to COVID-19 clinics, vaccine clinics rather, to make sure that those are accessible for everyone in the community. Another one that pops into my mind is our partners at the Gallaudet University were able very recently to collaborate with the DC, Maryland metropolitan area to make sure that there were fully accessible sites so that people who might communicate differently were able to be hearing and learning and getting the same information at the same time as everyone. So that's another example. And then a student example that comes to mind, just for a little geographic diversity, we have a student who is working through our work right now as a disability inclusion coach in Idaho and working with regional partners to review emergency plans to make sure that there are disability inclusion opportunities at every step of the way. So those are just a couple examples.
All right. The next question, someone was curious if ASTHO, when you were mentioning that they had embedded people, if ASTHO has someone embedded in the U.S. Virgin Islands Health Department.
So this is Adrian. I would need to look at their roster off the top of my head. I don't recall, but we can share their roster with you if you contact me. My email is agriffen@aucd.org, and I'd be happy to look that up and get back to you.
All right, great. Next question. What are your suggestions for trying to build relationships with those within local government who are not willing to work with us? They have remarked that they are qualified and do not need or want the public.
Yes, this is Adrian. We wish that was not the case, but sometimes that happens. With the Prepared for All approach, it's a strengths-based approach. So you can really have some conversations with others who might think they're already doing it. They might think they're already doing the work of inclusion, but really they're not doing all of the steps or not doing it completely. So with this strengths-based approach, you are able to look at where there are gaps and look at where you have resources and where you have needs to develop further. Sometimes having that conversation will open doors so that there can be some stronger relationship building, and you can bring in other partners to really align and make sure that the gaps are being addressed. So that was one thing that I could think of just to offer for this person. But Sue, I know that you have had this in your practice happen in real life. Do you have other thoughts on this situation?
Thank you. I do, and I agree with you. I would try the soft approach first. We provide a flexible approach, so you might be able through our strategies to find an in that particularly resonates with local planners and managers. The other thing is if your community has over, Lewis, remind me, 20,000 people for an ADA coordinator, 50,000 people? I can't remember, but there's a population number that if you have over that number, your city or town or county has to have an ADA coordinator. And you could see if you could make inroads that way. When I've worked with communities and they're particularly recalcitrant, I then try to go with a budget approach and talk about how having inclusive planning is more efficient, and provide some reasons why. And then, and it's happened only a few times, but it's happened, I have sometimes had to put my lawyer hat on and talk about legal obligations under the ADA. And in one memorable experience, I had to provide sort of a stark example of what would happen if Project Civic Access, which is the Department of Justice investigation program, if they came to town and happened to hear what the folks I was speaking with said to me. And between those approaches, I was able to be very convincing. But I want to emphasize, I save the heavy-handed approach for rare circumstances after every other possible approach has been tried. The other thing you can do is say, again, this may be review of the plan after they've written the plan, because I do know in at least one place I worked, the town directed that the emergency manager and only the emergency manager write the plan. So they were kind of stuck. But I would try to find some way around it before being heavy-handed. I hope that answers your question.
And then just to clarify your question to me there, Sue. I believe what you're referring to is the DOJ guidance about ADA coordinators, and that is actually based on the number of the public entities that have 50 or more employees. It's not a population, but an employee-based thing, and they're required to have the grievance procedure and to designate at least one responsible employee to coordinate ADA compliance.
Thank you so much for clarifying.
Yeah. All right. The next question is, which resource link do you believe would aid new disability specialists to be successful with inclusive ideas and preparedness actions in the local health department setting?
Adrian, I have a thought, but you may be having the same thought.
Go ahead, Sue. Go ahead. I was still thinking, and I would love to get maybe even more clarity on where this person's housed and et cetera. But you go ahead.
So to me, if it's a local health department, I would first look on the NACHO website and see what they had, because those resources are made for local health departments. But I too wanted a little more info beyond that. I'm wondering if the questioner wanted to know which part of the online course would be better, or maybe there's another question being asked altogether.
All right, we'll have to wait and get to that as we scroll down the list here. So let's put that aside for the moment. The next question would be, does your communication resources also list plain language examples and how to write PSAs in language that is understandable to people with intellectual or developmental disabilities or traumatic brain injury? What we did in our state as the State Disability Access Agency is we approached state and county emergency management leaders and convened an interagency working group to discuss disability and access issues.
So this is Adrienne. The short answer is yes. Our resources do describe this. And in fact, if you take the online training, a couple of the modules touch on how to do this and the reasons why it's so important to do this.
Okay, great. And now we do have a response from the person who asked that other question that you wondered. She says, yes, which part of the online course? Sorry for any misunderstanding. So just to go back, she's asking about which of the online course, which resource do you believe, do you believe would aid new disability specialists to be successful with inclusive ideas and preparedness actions in the local health department setting?
This is Sue. I think it would depend on what the specific issue is, but I might start with lesson 2, which is applying our process to emergency dispensing sites for COVID vaccines, because a lot of community health departments on the local level are involved with that. If the group wanted to engage in whole community planning, then I would suggest modules 7 and 8. But I think depending on what your public health department has as a specific issue, you'll be able to pick a module. The other thing is, if you can't decide, we have some very short intro videos. You could watch a couple of those if you wanted to pick just one and were trying to decide.
All right, great, thank you. So let me ask a question. So I know that this is newly released, basically, right? And so do you have what evaluation plans might be involved in here, or how do you have any follow-ups that you're going to be able to be doing?
Yes, this is Adrienne. Each of the lessons actually has a pre-test and a post-test. So that is one way that we will be evaluating, did this make any difference? Has the person who's visiting learned anything? So that's one strategy. Another is we're really using some observational qualitative strategies to look at the town hall discussions with partners to see how that space is being leveraged, how the application of the Prepared for All initiative and materials are being leveraged to make differences at a local level. So we're looking at the town halls. And then the other piece that I would hold up is the work that we're doing with trainees through the Disability Inclusion Coach Program. Right now, we're up to 14 different trainees across the country, but we're hoping that that just grows by leaps and bounds. It is brand new, as you just said. So we'll be looking at not just the number of trainees who sign up to be disability inclusion coaches, but how many then follow through with their local areas and really apply the Prepared for All approach. So those are the key strategies that I would offer. Sue, I don't know if you have anything else you wanted to add in terms of evaluation.
One thing on a very simple level is the number of resources we develop and the number of resources we've added to the Public Health is for Everyone toolkit. I forget what the exact number is, but we reviewed over 300 resources that we have in a database, and we're moving them into the Public Health is for Everyone toolkit. And then you can look at how many people are choosing to access that part of the toolkit.
All right, very good. There's another question here about, have you considered doing a presentation for the National Association of ADA Coordinators, for AUCD, also an ADA credentialing body?
This is Adrienne. We would love to do that. We would love to do that. So I would.
You can coordinate
ask.
with that with me.
Yes. Yeah. Thank you.
All right. So we realize that many of you may still have questions for our speakers, and apologize if you didn't get a chance to ask your question. But if it is an AD, well, let's Gabe, if you can roll back one screen, they can have the contact information again, or two screens, I guess. There we go. So if you have your question, if you have questions and you still want to ask Adrienne or Sue, there's their contact information on the screen. You're welcome to ask them that questions. Or you can also contact, if it's an ADA issue that this raises for you, you can contact your regional ADA center at 1-800-949-4232. You will all be receiving an email with a link to an online session evaluation. Please complete that evaluation for today's program, as we value your input and want to demonstrate the importance of the presentation and the sessions and the series to our funder. We want to thank Adrienne and Sue today for sharing their time and knowledge with us, and a reminder for all of you that the session is being recorded and it will be available for viewing next week at adapresentations.org in the archive section. And I believe that they are providing us with even other materials that will be in that archive section. So feel free to get there next week and see what you can find and review about this session. Our next webinar will be held on June 10th and will feature a presentation by FEMA about vaccine accessibility that they helped develop here for the SuperPod areas. We hope that you can join us. Watch your email 2 weeks ahead of time for the announcement of the opening of registration. So thanks again, Adrienne and Sue, and thank you all for attending. And that will now complete today's session, and we look forward to seeing you on June 10th. Have a good rest of your day, everybody. Bye-bye.
Thank you.
Thank you.